This story raises a condition that Beth just mentioned, postpartum psychosis, that many of us had never heard of. We do know that mental health can vary significantly once a baby's born. It can be the happiest time in a woman's life, or it can be the darkest. Dr. Mallika Marshall joins me now. And doctor, some degree of depression, some degree of baby blues, that's not uncommon.
No, it's actually quite common. I experienced it with after the birth of one of my children. Many women sort of experience this postpartum blues, or what's often known as baby blues, after giving birth, which really is a mild form of postpartum depression. It usually occurs within a few days of giving birth, and it's often written off as the normal stress associated with taking care of a newborn. Moms may be moody, they might have trouble sleeping or focusing, or have frequent crying spells. Baby blues usually goes away within a couple of weeks, but if the symptoms are more severe and last for more than 2 weeks, it then becomes postpartum depression. The mom may feel incredibly anxious, irritable, angry. She may feel overwhelmed or racked with guilt. She may feel like she's a failure as a parent and actually have difficulty taking care of her baby. Now, postpartum depression can be treated with therapy and medication, but then there is a worse form.
Right, and that's what we're talking about today. So postpartum psychosis, what is that?
So postpartum psychosis is much less common than postpartum blues or postpartum depression, occurring in only 1 to 2 out of every 1,000 births, and it's incredibly dangerous. It really is an emergency. It usually appears within 2 weeks of childbirth, and women often experience hallucinations. They may hear voices or see things that aren't there, delusions or false beliefs, disorganized thoughts, confusion, and really bizarre behaviors. Patients may be suicidal or have thoughts of harming others, including their own children, especially the newborn. Many women with postpartum psychosis are eventually diagnosed with an underlying psychiatric disorder, such as bipolar disorder. But what happened in Duxbury is so horrific and so sad. I think a lot of people are probably wondering what they can do to try to identify someone who might be at risk.
Right, well, I mean, that's it. I mean, I think so many of us today are trying to get our heads around this and just try to comprehend the incomprehensible. So what can be done?
So first of all women really should be screened for postpartum depression, both during pregnancy and in the postpartum period, asking questions like, how are you feeling? And have you ever had thoughts about harming your baby? Now, those with a family history of mental illness or previous episodes of postpartum depression or psychosis are at higher risk of having it again with subsequent pregnancies, and they really should seek treatment before symptoms begin. Once it sets in, postpartum psychosis really is considered a medical emergency. These patients should not be left alone with their children and usually need to be hospitalized for specialized psychiatric treatment.
All right. Thank you so much, doctor.
You're welcome.
And if you know someone, or if you are struggling, there is help. There is someone available to talk with you 24 hours a day, 7 days a week. Just call 988. David?
All right, Lisa, doctor, thank you.